Hello and welcome to my weekly video blog, and today on A Vogel Talks Menopause I'm going to be talking about dry, itchy eyes in the perimenopause and menopause. If you like my tips and advice, then please subscribe and remember to hit the bell icon so you can be notified of all my new videos. We do know that the eyes can be impacted in quite a number of different ways during the perimenopause and menopause, but the main symptoms seem to be dryness, itchiness and irritation. So today I'm going to be talking about what can cause these symptoms and what you can do to help yourself. So what exactly does it feel like? So it can be sort of stinging, burning, scratching sensation. It can almost feel like you've got grit in your eyes, but nothing you do will take it away. It may well be that your eyes start to get red, they start to get puffy. You might find that they water a lot more, and it's quite interesting because if your eyes get dry and irritated, your eyes will very often produce more tears to try and wash it away. So watery eyes can be as a result of dry eyes. You may also find that you're much more sensitive to light, and also that your eyes get a lot tireder quicker when you're doing any kind of close-up work. So the main causes, we're looking at hormones decreasing, especially estrogen. So estrogen helps your tissue to retain moisture. So if your estrogen falls, then a lot of the tissues in the body can start to dry. So that can affect the skin, it can be the membranes of the mouth, the nose, the eyes, and also the vagina. You may find as well that just because of all these changes going on, that you get more discomfort with the eyes more regularly, you get the inflammation, you get the gritty feeling. But you may also find too, although for some people their eyes get more watery, for others you may actually end up producing less tears, and that can have a big issue on eye comfort as well. The other thing that can happen is that going through the perimenopause and menopause, your immune system can be compromised a bit more. So you may find you're getting allergies, and a lot of women find at some point they may start getting hay fever, which they've never had before. And again, with allergies, you get histamine, you get itching, you get all the signs of hay fever symptoms, but these can happen ongoing as well. So they're not necessarily just at hay fever season. You can get irritation and allergies throughout the whole year. It can be just due to age. You know, as we get older, we produce less tears, so our eyes can dry, and dry eyes tends to be quite a common symptom in people over 50, regardless of where their hormones are. It could also be medication. So if you've just recently started new medication and you suddenly find your eyes are dry, then just check the patient information leaflet and all the potential side effects, just in case it's something to do with that. So the best way to treat your eyes, obviously hydration as usual. So make sure you're drinking plenty of water to keep all the tissues hydrated. There is a great supplement called sea buckthorn oil, which can really help with dry eyes. It's great for dry mouth as well, and vaginal dryness and the skin. So it covers a huge number of dry issues, so it's certainly worth trying. If you're in an environment, maybe like an office or at home, if you've got the central heating up in the winter, then the atmosphere can be dry, and that can affect your eyes too. So maybe go for a humidifier, or even just put a little bowl of water onto a radiator to keep a little bit of extra moisture in the atmosphere too. You can look at eye drops. We have 2 eye drops that can be helpful. We've got extra moisturizing eye drops for dry eyes, and also if you're getting allergic reactions, we've got the Plinasan hay fever eye drops too. If it's general allergies, you can look at nettle. That's a really supernatural antioxidant. You can go for a liquid tincture, or you could go for a couple of cups of nettle tea on a daily basis. Remember to wear sunglasses in the summer as well if you find that bright light is affecting you. And if you're doing a lot of computer work or screen work of any kind, or any kind of close-up work like reading, then give yourself eye breaks. The palming of the eyes just for a few seconds can be really helpful at resting the eyes before you get back to your work. The other really important thing is here, falling estrogen going through the perimenopause and menopause can affect your eyesight generally. So your eyesight can start to deteriorate as you go through these processes. So it's always really important to get your eyes checked on a yearly basis, especially when you're over 50, just to make sure that the eye irritability or discomfort is there's nothing else going on too. So just remember that one. The other thing too is, for those of you in the perimenopause, you may find that the eye issues just start a week or so before your period, but then afterwards they're okay. So again, this is usually an indication that it has to do with falling estrogen as your estrogen starts to fall before a period. But again, all these tips will help as well, so certainly try them. So I hope you found this one helpful. It's a really common symptom for a lot of people going through the perimenopause and menopause. If you have found this to be the case for yourself, and you've find things that have worked really well, then please share them. We'd love it when you share all your tips, and everyone else loves to read the tips too. So thank you for all of you who do that on a regular basis, and I will see you next week for another edition of A. Vogel Talks Menopause.